More people in the world are dying from heart disease than ever before, and India's young adults are no exception. We're talking about heart attacks, cardiac arrests, strokes, and much more. Celebrities like Puneet Rajkumar, Siddharth Shukla, and more recently RJ Rachna, all under 50 and seemingly fit, died from a heart attack or a cardiac arrest. Andhra Minister Gautam Reddy, who recently recovered from COVID, also died from a cardiac arrest in February. Just take a look at these statistics. Indians develop heart disease at least 5 to 10 years earlier compared to the rest of the world. 50% of all heart attacks occur in Indian men under the age of 50. 25% in men under the age of 40. Globally, cardiovascular diseases are declining among women, but in India there's been a 3% rise from 1990 to 2019. So why are so many young Indians in the prime of their lives dying from heart problems? Is there a connection between COVID and heart disease? What are the warning signs that you should watch out for? Let me explain. But before I go into that, I just want to quickly remind you that stories like this take a lot of time and effort, and we can't do this without your support. So do become a member of the News Minute today. And to catch every episode of Let Me Explain, which comes out every week, don't forget to subscribe to our YouTube channel. We spoke to a few doctors to understand whether Indians in their 30s and 40s dying of heart disease is a new phenomenon. They say that it's not exactly new, but this trend has been on the rise for the last few years. So it is worrying. Take for example this study carried out over 2 years by the Sri Jayadeva Institute of Cardiovascular Sciences in Bengaluru in 2017. What it found was that out of 2,200 patients, 35% had their first cardiac event before the age of 35. Another study in 2016 found that over 50% of Indians who died of cardiovascular diseases were under the age of 50. I know we normally associate heart disease with young Indian men, but the doctors we spoke to say that both men and women are now equally vulnerable. Although it was fairly uncommon for young Indian women to present with cardiovascular diseases a few years ago, doctors say that they are now seeing more women being admitted for heart failure and heart disease. So why is this happening? What are the factors contributing to these heart problems? Let me break this down. First, there are traditional risk factors like diabetes and high blood pressure. There's a high prevalence of type 2 diabetes and hypertension among young Indians today. If you're a smoker, data shows that heart disease in younger people is more likely to be caused by tobacco use. Increasing obesity is another factor. And if you have a family history of heart disease, then you're at risk as well. 2. Doctors are seeing non-conventional risk factors in many young Indians who have had cardiac issues as well. These include pre-diabetes or insulin resistance, low vitamin D levels, abdominal obesity, premature menopause, a fatty liver, among others. 3. Lifestyle and behavioral factors. We're working longer hours, have high-pressure jobs, and dealing with job loss and job insecurity. All of this is causing stress or poor sleep patterns. To add to that, we're eating more junk food and not getting enough physical activity. Doctors say that more often than not, it's a combination of these factors that's leading to heart attacks and cardiovascular diseases. Now, there's one more factor that's possibly increasing a person's risk to heart problems, and that's COVID-19. One US study found that even a mild case of COVID can increase a person's risk of heart disease. People who had recovered from severe or moderate COVID were more likely to have a stroke or heart failure. What the study showed was that it didn't matter how old you were or whether you had comorbidities. If you had COVID, you were at risk of a cardiac problem. There is no India-specific data at the moment, but cardiologists we spoke to say they have seen people between the ages of 40 and 60 presenting with heart failure and inflammation of the heart. These patients had recovered from moderate to severe COVID at least a month or two earlier. So why is COVID-19 causing these heart problems? Doctors say that the novel coronavirus causes inflammation of blood vessels. For example, there may be inflammation to the arteries supplying blood to the heart, which can trigger heart failure. Such sustained inflammation of blood vessels can cause clots to form, and this in turn can lead to blockages in the heart and can trigger a heart attack. Inflammation can also cause high blood pressure and increase cortisol levels, and this in turn can lead to your heart beating very fast or very slow. So what are the symptoms or warning signs that you should watch out for? First, there are the classic symptoms of heart disease like chest pain or discomfort or tightness, pain in the left arm, shortness of breath, pain in the jaw, throat or neck. Second, doctors say that if you're experiencing any of these 4 symptoms, you should get a cardiac evaluation, more so if you've recently recovered from COVID. Extreme tiredness, if you're struggling to climb a flight of stairs, swelling of the feet, and increased heart rate. Third, there are many people who present with atypical symptoms like severe pain in the stomach and sweating, presenting like gastritis, giddiness, and pain in the right shoulder or upper back. The issue is that many young Indians tend to brush off these warning signs or ignore them completely. If you're experiencing any of these symptoms, go to the doctor and get a health checkup. But there's another problem. Many people don't show any of these symptoms, which is why doctors strongly advise patients to get a full health checkup including ECG and echo every year if you're over the age of 40 and once every 2 years after the age of 35. In addition to this, you can also make some lifestyle changes. Exercising at least 30 minutes a day, eating right, quitting smoking, and learning to manage stress. One of the biggest reasons young Indians are dying from heart disease is low awareness and lack of testing. Remember, it's never too late to start taking care of your health. Tell us what topic or issue that you'd like us to delve into in the next episode of Let Me Explain. Also, if you've liked this video, don't forget to hit the like button and share this video with your friends.